And guess what? The estrogen receptor beta is a real jerk in menopause and postpartum. And the estrogen receptor beta becomes crazy during hormone fluctuations, and that is why women during these transitions have increased tendonitis issues out of the blue, because it is not just mechanical, but chemical. Stenosing tenosynovitis of the first dorsal compartment of the wrist is common, but how is estrogen involved is still unknown. We have previously reported that inflammation was involved in the pathogenesis of the ailment, and in the present study, we extended our investigation of the estrogen receptor beta expression to determine whether estrogen is involved in the pathogenesis of DenQuervain's. And they found that the estrogen receptor beta expression in the retinaculum was positively correlated with disease grade and patient age. Additionally, disease severity was associated with inflammatory factors like the interleukins, COX-2, and in the chemical soup, garbage, inflammatory markers. What if I told you your tendons have estrogen receptors and your tendons do not like hormonal fluctuations? So when you are postpartum, buckle up. Your hormones are going to disrupt your tendon. And it happens in a few specific people. Let me show you something. So why did you get that DenQuervain's when you were postpartum? What's your risk factor? DenQuervain's is 6 times more likely to affect women than men, and you know what that means. Your estrogen receptors in your tendons are getting real spicy. And if you're postpartum, your tendons don't like that hormone fluctuation. It happens in the first dorsal compartment containing the abductor pollicis longus and extensor pollicis brevis. And it is reported most commonly in pregnant and lactating women. Now, interestingly enough, your child's birth weight, if you got this when you were postpartum, is not a factor in you getting DenQuervain's, because we thought it was because you were holding this baby in such a way that you had an increased risk, because the heavier the baby, the more the load the tendon. No, because that's a chemical factor, not mechanical. The risk factor for DenQuervain's was it the first pregnancy, and was the length of the pregnancy more than 40 weeks? The longer you were pregnant past 40 weeks, the more likely you are to get DenQuervain's. That means the longer you are pregnant, the more your hormones are wackadoodle-moo, and the more time your estrogen receptors have to be grumpy. The more time your hands and feet have likelihood of being swollen, which means that tunnel, that sheath, all that chemical milieu surrounding the tendons, the higher likelihood of irritation. DenQuervain's is characterized by pain on the dorsal area of the hand and pain while performing ulnar deviation and flexion of the wrist. So if you're holding a child, several studies have found that DenQuervain self-resolves after you stop breastfeeding. It's no surprise to me that when these women stopped breastfeeding, their DenQuervain's resolved, because when you are breastfeeding, even if you're feeding your child once a day, you are still very hypermobile compared to normal you. In 6 weeks from the last breastfeeding that you do, I swear my patients resume normal connective tissue tensile strength. Okay, it is not surprising to me that DenQuervain's was resolved. Now, some might say it's because maybe they're not holding their child as much, but I think it has more to do with the chemical soup of you and your hormones and stabilizing hormones. Previous studies have proposed that the repetitive motion of the muscles and the tendons in the first compartment is what is causing the DenQuervain's, which it's not to say that there's not an extra slip. There can be an anatomical variation. There could be a thickening of the tendon sheath. It's not just mechanical, though. There has to be, I think, a chemical piece, and that they saw that there is a thickening of the tendon through an accumulation of a mucopolysaccharide. So basically sludgy, not good, slippery conditions to have that tendon slide. In another study, they saw that there was a significant anatomical variability in the first dorsal compartment, including the existence of an accessory tendon slip, and then it makes a septum in the patients that have DenQuervain's. Septums are anything that separates. You have a septum in your nose, you have a septum between your biceps and your triceps, you have a septum between your hamstrings and your quads, and your IT band issues that you have, that is a septum. Septums are an area that transmit force, and I think things can get hung up. And if you have an anomaly, you're more likely to have a hang up and of course have an issue. Here's an example of the motion that they are talking about with the ulnar deviation and flexion to irritate this area, the dorsum of the thumb. A long pregnancy greater than 40 weeks of gestation has a 5.8 times higher risk of developing DenQuervain's. This association may be explained by the edema of the dorsal compartment. Think of it as carpal tunnel of the thumb. And instead of like with carpal tunnel is trapping the nerve, it is trapping the tendon. But in conclusion, an overweight mother with a prolonged pregnancy and in her first pregnancy has an increased risk of presenting with DenQuervain's disease. According to the findings, the weight applied to the carrying wrist, a heavy baby or twins, does not predispose mothers to this pathology. Physicians should readily consider these findings when educating and counseling patients, blah, 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 blah. Mechanically, what you do doesn't seem to matter. It is more chemical. Now, I'm going to say it's not that the mother was overweight. I would say that the mother had chemical inflammation that caused her to have a soup of yuck surrounding the tendon. And the overweight is just an indication of the systemic inflammation.